This is a panel discussion unlike anything you've ever experienced. Here's how it works. Pecha Kucha, it's a presentation style in which 20 slides autoplay for 20 seconds each, and these folks don't control their slides.
Without worrying about being modest, what was it about you? Your unique qualities, gifts, capacities, decisions made, or actions taken that contributed to this experience. Several years ago, a first grade teacher stopped by my health office in our dual immersion elementary school. She asked if I could test a student's hearing because his mom said that the reason why her son doesn't obey and behave in class is because he can't hear well. "I think he can hear fine. He just doesn't listen," said the teacher, but I told her to bring him by and see what we learn. When they stopped by my office, I met the student Christian for the first time. He did not make eye contact. Instead, his eyes were laser focused on my mouth, relying on them to help fill in the gaps of what he could not hear me say. How had the teacher never noticed? With a busy classroom, details often get overlooked. And when I met with his mom after school to share the feared hearing test results, through her tears and fear, she expressed gratitude to me. I believed her concerns, observed the same behaviors in her son, and through the act of believing in her, I had built the trust for the unknown journey to come for Christian. One of my favorite quotes is, "If you can change the world, you change the world of a child," by Patricia Schroeder. The future of pediatric healthcare experience is collaborations across organizations based on human connections that make the healthcare process smooth, no matter the complexity, with intentional focus on vulnerable populations. Pediatric healthcare must be high-touch, high-tech, and we need to collaborate on the tech to smooth out access to care and staff processes, freeing up the front line to engage with patients and families one connection at a time. A collaboration that ignites my passion for pediatrics is the prevention of emotional harm in healthcare. To do no harm, emotional harm, we must capture, measure, categorize, and understand the data. Just like the movement to prevent physical harm, we must also build systems and structures that empower the front line to prevent emotional harm and make it easy for them to do and say the right thing. I am grateful for all the brilliant people who pioneered emotional harm reporting, shared their stories, and published papers. Perhaps some of those pioneers are here in our midst. Thank you. 5 years ago, Children's Minnesota had the courage to implement our own emotional harm reporting. Medical trauma, prejudice, and the experiences of vulnerable populations are important signals to watch for in the data. One trend we noticed that developed over these past 5 years was instances of emotional harm caused when staff misgendered patients or used the wrong name and pronouns. Reports detailed the distress patients expressed when having to wear armbands with the wrong name, the frustration when one clinic knew the correct name and pronouns only to be called the wrong name and pronouns somewhere else. I, too, misgendered a patient. I entered a room seeing the patient, a baby with beautiful curly hair and pierced ears and a name that I assumed was feminine, and I asked, "How is she doing?" And the mother deftly corrected me, saying her child is a boy. And I wondered how many times she had corrected staff during their stay. And I was mortified and apologized for my assumption. I had experienced what our emotional harm reports signaled, my own biases and lack of easy-to-access documentation leading me to misgender a patient, creating tension and misunderstanding with a family. What can our system do to make it easier for staff to get the name and gender right from the beginning for all patients? We have an opportunity to eliminate emotional harm for our gender-diverse patients with solutions that help all kids not be misgendered based on name or appearance. Solutions to improve collection and visibility of the chosen name and pronouns require collaborations with our medical record, ancillary system partners, multiple internal stakeholders, and connections with community. This work is a transformation in progress, and transformation isn't about adding more work to your life. It is about shifting your perspective so life can become more fun, magical, and joyful, says Sherry Salata. How can new technologies in AI transform our staff's work experience? Imagine the smiles on the faces of physicians when I shared one organization's learning on using AI to draft a visit note. It was pure delight. Engaged staff deliver differentiated experiences for patients and families, so study AI solutions with discernment and embrace the solutions that improve efficiency and reduce waste, giving time back to staff for patient care. Time back to be present for those small moments of connection that mean the world to patients and families and that become their lasting stories. The last time I saw Christian was the end of his first grade year, and his eyes met mine, reflecting the sadness in both our hearts. He knew that I would not return to the school in the fall. Hearing aids had transformed his academic experience. No more reports of bad behavior. He could hear and participate not only in Spanish, but in English and American and Spanish Sign Language. Christian's future is bright, and my heart is filled with the gift of all the moments spent connecting with him, sharing laughter and tears with his mom, celebrating scheduled appointments and secured financial aid. He was scheduled to get implants over the summer, and collaborations with the school and clinic smoothed out the complicated pathway to appointments and language access for him. In today's rapidly evolving healthcare landscape, hearing stories of children like Christian and patients' experiences of emotional harm deeply sadden me. As healthcare providers, it is our responsibility to drive transformative change in our practices. We need to shift our mindset and the way of thinking and ensure that we have easy access to patient information, such as chosen name and pronouns. Having that right information will help us avoid making assumptions and causing emotional harm. So let's work together and ensure every child has access to quality health care regardless of background or circumstance by preventing emotional harm and embracing new technologies. Tell your stories of when you were your best self. Ask your colleagues and teams for their stories. And I'll finish with a quote from the Dalai Lama. Just as ripples spread out when a single pebble is dropped into the water, the actions of individuals can have far-reaching effects. We each have the power to change the world of one child, one connection, and one collaboration at a time.